Hi, my name is Dr. Tommy Apara, and I'm a retina specialist at Eye Surgery Associates. So the reason why I chose ophthalmology was I've always been fascinated by the eye. It's a small organ relative to the other organs inside the body, and yet it's so complicated, and it does amazing things. I started with doing research on the eye, and my mentor, who was very inspirational, inspired me actually to think about doing ophthalmology in general. And so the only question for me was, am I going to be a scientist in the lab and just do my research on ophthalmology, or do I want to be a physician in the clinic taking care of patients? So during a rotation where I actually followed my mentor around, I got to see patients in ophthalmology, and I was really amazed by how much we could do to improve a patient's vision. And I was inspired to say, I think I want to do that. I think I want to become an ophthalmologist. And the question became, what type of ophthalmologist do I want to become? And I was drawn to retina because, it seemed like one of the subspecialties of ophthalmology where I could use my hands. And I'm a very hands-on type of person. I like to use my hands to get involved, to do something. I don't think I would be satisfied with just writing prescriptions all day long. So I like to get in there with my hands and actually fix a problem that a patient is having with their vision. And I feel a lot more fulfilled that I did something with my physical hands to help improve a patient's vision. So the most rewarding part of my role when it comes to patient care is watching the transformation of a patient going from a position of poor vision to better vision. And I'm just thrilled to be involved to help a patient see better, and to then call a patient's referring optometrist or physician and let them know, hey, your patient's doing a lot better now, and things are going very well. That just gives me so much joy and happiness to watch that happen. So we at Eye Surgery Associates rely on our referring physicians or optometrists who actually are front-facing when it comes to seeing the patients, and they have a long relationship with the patients, and they are trusting us when they send us their patients. And we are part of a larger community of professionals who are tasked with taking good care of patients. I see it as I'm part of a team, a larger team, both here at Eye Surgery Associates and within the larger community, who have a job to take care of these patients. And so when we take care of a patient, we're doing it collaboratively. And I firmly believe that collaborative care gets the best outcomes for patients. So not only do we treasure our referring optometrists, I get a lot of joy in sharing with them and updating them on what's happening with the patients, letting them know what we're doing, and then making sure that the patient goes back and sees them and lets them know about how everything's going. And so that's all part of teamwork, and that's one of the reasons why I joined Eye Surgery Associates, because they are very team-oriented. You should refer your patients to Eye Surgery Associates for a variety of reasons. First is we're all board-certified, fellowship-trained physicians who care deeply and have studied for many years on the eye, making sure we understand the way the eye works and we can take care of patients with diseases or problems related to the eye. The second reason is that we all care about collaborative care with our patients, both with each other and with the larger patient community. We all have different backgrounds in our training, and we can work together as a team to make sure that all of our patients are well taken care of. The last reason is we value the relationships we have with our community of optometrists and other physicians in helping them address any of the eye surgery needs of their patients, and then sending them back once they're done for their ongoing care. We want to make sure to continue to build on those relationships and help them address any issues they have with any of their patients, but also make sure that the patients continue to go back and see them for their other medical needs.